What will I gain from this video? After watching this video, you'll know how to look for and identify collapse on a chest x-ray. The radiological signs of lobar collapse can be classified as direct or indirect. The only direct sign of collapse of the lobes is shift of the fissures, and this is the real hallmark of lobar collapse. There are various indirect signs that include increased lung opacity, compensatory hyperinflation of the surrounding lung, hilar shift, mediastinal shift, elevated diaphragm, crowding of the ribs, crowding of the pulmonary vessels, and obscured cardiac, mediastinal, or diaphragmatic borders. The collapsed lung will become too white. We can see the asymmetry between the two lungs, with the left being whiter than the right due to decrease in the total number of air within the left lung. Because of compensatory hyperinflation, the remaining non-obstructed lobes of the lung can hyperinflate. With this left upper lobe collapse, we see normal grayscale density of lung in the apical region. This is not a portion of the left upper lobe. This is in fact a hyperinflated left lower lobe with the superior apical segment extending all the way up to the apex of the left hemithorax. In this case also there's compensatory hyperinflation of the entire right lung. With lobar collapse, we can see hilar shift. In this case, the right hilum is higher than the left hilum, and that is because of pulling of the hilum superiorly by the collapsed right upper lobe. We can have mediastinal shift. With collapse of the lobes within the left lung, the heart and the remainder of the mediastinal structures are displaced to the side of the collapse. On the side of the collapse, we can also see elevation of the hemidiaphragm. This is due to overall volume loss within the right lung. On the affected side, we can identify crowding of the ribs. If we look at the interspace between the ribs on the right, the distance is fairly steady throughout the right hemithorax, whereas we can see that the ribs are closer together on the left related to left upper lobe collapse. With lobar collapse, we also lose the normal appearance of the central hilar vessels and the branching pattern of the vessels. Here we have a normal pattern on the right, whereas on the left we see very thin vessels that are extending to the hilar region. This is because these vessels are stretched by the collapse. So in summary, when we're looking at collapse, it's important to look at the lateral x-ray. Look for direct evidence of collapse, such as shift of the fissures. Indirect evidence of collapse may be present, and this could be related to loss of lung volume or displacement of normal structures. Collapse can be difficult to identify, especially if the collapse is complete.